Hey everyone, welcome to the Brain Body Reset Podcast. I'm your host, Spencer Zimmerman. Beyond the diagnosis and symptoms, there's a path to feeling better. Dive into the world of brain-body connection and learn how to optimize your health. Podcast episode number 10. I'm joined by Dr. Phyllis, who is a triple board certified physician who went through her own health journey and lost 100 pounds. She specializes in genetic weight loss, anti-aging, and longevity medicine. To see the rest of her bio, please look in the show notes. Enjoy. Dr. Phyllis, welcome to the show.
Thank you so much for having me. I'm looking forward to our conversation today.
Yeah, I'm excited for what we're talking about, right? Over the past few years, it's been everything pharmaceutical with weight loss, right? So we're going to dive through that and talk about that, because you are an expert in weight loss medicine. So first, what inspired you to hop into the realm of weight loss medicine?
Oh, for as long as I can remember, I struggled with my weight. Weight has always been an issue for me. I tried every single diet and workout plan imaginable. Everything from the cabbage soup diet to intense home workout systems, insanity. I don't know if anyone remembers that, but despite all of my efforts, nothing really seemed to work long term. And so I was exhausted, frustrated, and I really felt as a physician, I was failing at something that should have been really straightforward. So I knew if I was struggling, other people were struggling as well. And so when everything changed for me and I discovered the power of genetic testing and I learned how our genes influence weight, metabolism, cravings, and even how our body responds to exercise and food, I realized that it wasn't, willpower, lack of discipline, but it was me working against my genetic blueprint. So I'm once I was able to lose 100 pounds by, transforming my relationship with food, my body, my health, and realizing that it wasn't just about weight loss, it was about gaining energy and confidence and control over my life. That's when I wanted to share this with the world. And that's what made me create Gene Lean 360 and really help to specialize in helping women to unlock their own genetic blueprint and to really address the root cause of weight loss resistance and chronic symptoms. So it's not just about losing weight, but for me and for the women that I work with, it's really about creating this life where health feels effortless and aligned with who you truly are.
Yep. And that is key, the effortless part, because everyone, right? Everyone starts the diet, everyone starts the exercise, but people, they struggle with consistency. So we'll definitely talk more about that. And, and we go back to what you said, for so long, it's just been, and don't get me wrong, right? This is definitely some people where it's like, well, you just got to eat healthier. You just got to exercise, right? Like some people, that is legitimately their thing. But there's a point where people are like, look, man, I eat as clean as possible and I exercise and nothing is budging. So let's go into kind of the genetic side and how does genetics play a role in this, because there's, especially in the natural medicine side, there's kind of been this battle with genetics. Like, oh, well, your environment, genetics may load the gun, but it doesn't pull it, So it's like, well, how much should we appreciate genetics versus how much is it like, well, that's an excuse? Because that's a debate that I'm sure you hear all the time.
All the time, all the time. And what I say to people is that genetics is not your destiny, it's your strategy, right? Because genetics influence the way our bodies function and including how we process food and regulate energy and manage weight. So there is specific genetic variants that can explain why some individuals struggle with issues and challenges like reduced thermogenesis, efficient fat storage, carbohydrate metabolism issues, and chronic inflammation. And when we are able to look at these genetic variants, we're able to highlight why traditional diets often fail. And it's because they don't account for this genetic diversity. And so this is where my 12 genetic avatars come into play. Actually, if you check out my book, Lean Genes, I talk about these 12 genetic avatars. And so, for example, cortisol carriers, these are women who often have genetic variants in genes like your corticotropin release hormone or your glucocorticoid receptor, which is NR3C1. And this will dispose women to actually have heightened sense of stress response and chronic inflammation. And this could lead to fatigue, weight gain, and difficulty maintaining energy levels. So it really is at that point, if you are a cortisol carrier, not just calories in, calories out. It really is about learning how to manage your cortisol given these genetic variabilities. But also, there's dopamine drivers. So there's genetic variations in the dopamine receptor, your DRD2 gene, and your SLC6A3 dopamine transporter, which can influence the brain's reward system. So, making sure that these women that are prone to cravings due to issues with dopamine regulation understand that they will be more likely to have issues with emotional eating. So, what we do is we address this by regulating dopamine activity and reducing the reward driven food choices. And another one that comes up very often is the avatar inflammatory overload. So, variants in genes like IL-6, TNF alpha will increase susceptibility to systemic inflammation. And so, we always hear this word inflammation. I feel inflamed, I feel bloated. And acute inflammation is okay when we're dealing with an acute injury, but chronic inflammation will impair metabolism and cause weight loss resistance. So, when we are able to target inflammation with specific anti inflammatory diets specific to your genetics and stress reduction, then you'll have significant improvement. So, all in all, these genetic factors and matching them with the right genetic avatar, we can really create these highly personalized strategies that address the root cause of weight loss resistance and chronic symptoms. And again, for someone with reduced thermogenesis due to, say, the UCP1 gene, these variants might benefit from lifestyle changes that will boost their energy expenditure, while someone, like I mentioned, that has dopamine driven cravings will thrive with strategies that regulate their brain chemistry. So, this is empowering for women to finally have an answer to say, okay, what can work with my genetic blueprint instead of fighting against it? And then that's what makes the weight loss effortless and more natural and sustainable because you're understanding your unique genetics and it's allowing you to achieve the results that are lasting and truly aligned with your body's needs.
Awesome. And I don't claim to be the weight loss expert. I focus on brain health, and that's why we're doing this because we know obesity plays a massive role in the increased likelihood of cardiovascular disease, dementia, many cancers, and other things like that. And so getting weight down is super important. So, I think so far the takeaway is, there's not one magic diet for everyone.
No.
Um, so there's kind of, I want to go into kind of controlling appetite, right? So when we look at these medications, semaglutide, which, people know Ozempic and the
Mm-hmm.
others, right? You've got tirzepatide. A lot of the patients I see, I rarely prescribe these, but most people, they're on them,
Mm-hmm.
to lose weight. Sometimes they're losing 20 pounds. Sometimes they're trying to lose 100. But a
Mm-hmm.
common theme I see, they're almost kind of losing weight through starvation. Like
Mm-hmm.
they just don't have a desire to eat. And obviously, when people lose weight that way, we know they lose a lot more muscle than we'd like them to lose. So, what are some of the things that people should consider when it comes to, I guess, working on the cravings, right? Because people have cravings, and that's one of the reasons they fail. They're like, oh, well, I gave into it once and then that started a domino effect. So, what's some advice or strategies on that?
So I think the main thing that I like to tell people is that your cravings are telling you a story. So yes, medications like Ozempic can get rid of that quote unquote food noise, but if you're having a craving, it can be something underlying like nutrient deficiency. So I'm sure a lot of your listeners have heard of that phrase of um, overfed but undernourished. So the soil that our food is grown in is not the same soil that we had, say, 30, 40 years ago. And so we might be eating more food, but it doesn't have the necessary nutrients that we need in order to have healthy metabolic process and also to have a metabolism that's running quickly and efficiently. So if that is worsened by the fact that you have genetic variability that doesn't allow you to absorb or process certain nutrients, for example, issues in terms of methylation with the MTHFR gene, you might need methylated B vitamins. Um, that is also going to further worsen your cravings because you literally are craving specific nutrients. So some people, I was someone that would crave chocolate, and that ended up being something like a magnesium deficiency. So if people are willing and ready to get to the root cause as opposed to having a band-aid approach, then they can find a way to deal with their cravings in a real and effective way. But then also understanding that cravings can come about when you're having things like built up toxins. We are so exposed to things like BPA, plastics, chemicals that mimic things like xenoestrogens that can further affect your estrogen levels in your body, and that will affect your craving level as well. And then third, of course, is the microbiome. If you are eating highly processed foods, that is going to cause you to crave more processed foods because you're actually getting rid of a lot of the good bacteria and putting in a lot of bad bacteria that will spur a lot of your cravings and then also affect things like serotonin, which does come from the gut. Your hunger hormone, your fullness hormones, leptin hormones, and ghrelin hormones all get completely out of whack. So, taking the time to do this, of course, it's not overnight, but it is something that will allow you to have these long lasting changes without losing vital muscle because muscle is something that's not easy to replace as we get older, and muscle plays a key role in terms of our metabolism.
Okay. So, we get lots of times, right? People are going in, they're getting labs done, and they're getting some of the basic labs. Can you briefly explain, like leptin or adiponectin, are those labs worth doing? I know, or is that stuff you like checking on people?
I do check those labs, but more so from a genetic standpoint. So if you, why is your leptin low? Is it because you have variations in terms of your leptin or your MC4R gene, which can disrupt hunger and fullness signals? So this is important because it removes the stigma of lack of control, and then it shifts the focus into strategies that work with rather than against these genetic tendencies. So it really is just taking it a level deeper than just checking leptin and adiponectin. Because if you are able to look at, for example, ADRB3 variants, then you'll be able to know that, oh, I struggle to lose weight with cardio alone and I benefit more from strength training. And then, for example, if you had the FAB2 variant, you might require specific adjustments in fat and carbohydrate intake to optimize your metabolism. So it really is just taking it a level further to be like, what do I do now with this information? How can I apply it in an applicable way in terms of how I eat, the supplements I take, and the way that I exercise?
Yeah. No, and that's really good to know, because for me, with what I do, it's all about trying to look at the right patterns and get predictability. And we know that
Mhm.
having a gene doesn't necessarily mean it's a deterministic thing. And so it's good that there's things that can almost be cross-checked,
Mhm.
cross-referenced when you're looking at leptin or adiponectin, or, like, for example, with MTHFR, we look at homocysteine to say, like, well,
Mhm.
how big of an issue is this? Um, because it's not necessarily deterministic, but it can be at play in it. And by having those extra pieces of the puzzle, now it's a
Mhm.
higher predictability. And I think that definitely helps people because a lot of times, no matter what it is that people are looking for help with, oftentimes it's like they're grabbing at straws and they're just like, well,
Yeah.
I'm doing it out of desperation. But it seems like, by understanding the genes plus tying it in with different, hey, you know what? We see these genes. Now I'm going to have you change your exercise in this way. Let's see how that's influenced and kind of what the body's response is.
Yeah. And it's because there's so much misinformation out there and just general too much information, I think it helps people know what's right for me. So it does sometimes feel like you're grasping at straws, like, oh, well, I saw this on TikTok, so I'll try this. Whereas it I think it gives you more bang for your buck. You know what will work, and you'll be able to build a strategy based upon that.
Yeah, because a lot of people burn out, So,
Yeah.
what's kind of the average, like let's say you've got someone, right? They're struggling, you do your testing, you find out certain genes. Like what's kind of the range of like, hey, look, you may not notice weight loss until this time frame because a lot of people quit because they talked to someone, they read something online and like so and so they lost X amount of weight within a month
Oh,
or two
yeah.
and I
Mhm.
I I must suck, right?
Mhm, mhm,
Um
mhm.
so yeah,
I
what are
think
the
that's
thoughts
such
on
a
that?
great question because you need to put things into perspective that losing half a pound a week, 1 to 2 pounds every 2 weeks is actually normal weight loss. Now, if you are doing things that you're working in a program that's very specified, maybe a little regimented, you might be able to lose about 10 pounds per month. But those are for people that, are not as we're busy. So, you really have to understand that you're not going to be able to adhere to something perfectly. You're not going to be able to eat exactly to your genetic type, but you're still are going to get the results that you need in order to lose weight and to keep it off. And, if someone came to me and told me it would take me a year to lose 100 pounds at the time, even as a physician, I would have been like, oh, well, I want to be skinny now. So we all have this desire to have these immediate results. Amazon Prime, getting things shipped to us right away. And that's part of the reason why we're overweight, if we really want to be honest. We're so disconnected to where we get our food from, our food source. We, are sometimes eating food from the vending machine. I bet you 9 times out of 10, if we could see some of the food, from the farm itself, we probably wouldn't eat that food. Some of the food comes to us that's diseased. It needs antibiotics to get rid of a lot of the disease process in the meat that we eat. And so this has caused us to gain weight because we are eating food that we wouldn't necessarily eat, but because we need it faster, quicker, quicker, quicker. We're now in this situation where obesity is such a huge, massive issue. So I say use some patience. Use patience. It's always worth it. That year it took me to lose that weight. I would do it again in a heartbeat. It's completely transformed my life.
So do you have any tips, or things that challenge the thought process, right? Because it's easy when people are busy to grab something really quick, right? Like
Mhm.
they'd be like, "Oh, I'm gonna just drive through," right? Or my prior clinic, all my staff they did DoorDash like every single day, and I'm just like, man, like I'm bringing in my smoothie and all my fresh stuff, and it's just like DoorDash, and
It
like you said, it's the whole Amazon Prime thing,
yeah.
and we know people are going to struggle with that as they usually go through this journey. So just a
Mhm.
few tips or thought processes that can change it because it really is the small things in
Mhm.
those instances that changes trajectory.
Oh, 100%. I think the main thing is waiting for motivation. So some people are waiting to feel that craving or motivation to have a smoothie. That's not going to happen. And we don't feel the same way to need motivation to brush our teeth. And I think we need to start looking at what we put into our bodies the same way. It's not necessarily, and I think that's why people like the idea of DoorDash because I'm not going to prep my meal. I'll just eat what I feel like when lunchtime comes around. And it's this disconnect from how it makes our body actually feel to really giving into this high fat, high sugar hit that of dopamine that it gives us and not really paying attention to the other things that we get downstream in terms of feeling bloated, tired, fatigued. By the time we feel that again, then we're, door dashing again to get more food to get a little blip of energy. So I really, really encourage people to stop having such a reactive view to their day-to-day lives, to their health, and really start looking at preventative. We have way more power than we think we do in terms of our health. And as physicians, we do see patients come to us and expect, oh, well, the doctor will fix it. And oftentimes, these can be just band-aid approaches. If I'm giving you medication for your blood pressure, what I actually really want you to do is lose that extra 20, 30 pounds so that you don't need this blood pressure medication. So, starting to look at your life more holistically is going to drive the rest of your day. How you do one thing is how you do everything. So, start off the day with intention and let that intention carry you throughout the day. And that's going to be the game changer for you.
If you're finding this information valuable, please share this podcast with others and give us a 5-star review, as that is the only way this podcast grows. Please continue listening and keep enjoying. And so, are you a fan of like meal planning, or what type of strategy, right? Because in the instance, when you're hungry, you're just like, oh, what sounds good,
Yeah,
right?
you got a
Versus
meal
what
plan.
is good. Is it
Yeah,
meal planning? Is it just
yeah.
trying to figure out what your routine is? So you kind of, just like you said, brushing your teeth, right? Like you
Mhm.
don't think like, oh, it's morning or it's night, I should
Yeah,
brush my teeth. It's just like
just do it.
pre-programmed.
Yeah, and you have to do it until it gets to that point, and that's when I say effortless, that's what I mean. There is a huge mindset component in our program because you have to unlearn all of the things that you've done in the past where it is wanting to just order food to your house. It is learning that if I prepare this meal, I'm gonna feel great, I'm gonna have energy, I'm gonna save money, but you have to go through the motions of first knowing what to make, making sure it's something that you like and tastes good, fits in with your genetics, and then having that readily available. There's no equivalent to preparation and meal prepping, because you know why meal prep is so important? It's our society. If you don't bring a meal, you're probably going to eat garbage. That's literally how severe our society has become. You can't go into a drive-through and get anything healthy. You can't really even go to some of these restaurants and get healthy foods to eat. So it really is become to that point that if you don't bring a lunch, you're not going to eat healthy food, and you have to look at it that way.
Yeah, and it's interesting because there's almost now like a stigma, right? I even remember growing up,
Hmm.
like most people were eating cafeteria food. They weren't even bringing their lunch. And so like
Yeah.
we'd bring our lunch to school. It's like, and you'd have people trying to trade like, well, actually I want some cafeteria food, even though now it's like, oh man, like that was horrible. But
Yeah. It's
but
garbage.
there's
Yeah.
yeah, there's almost like a societal bias against people bringing food, right? It's like,
Hmm.
oh
Hmm.
well, and I think that messes with people.
Yeah, definitely. And I wonder why that is. I wonder what the case is about people. Sometimes I do think that when we see other people doing the things that we should be doing, it makes us feel a certain way. And I
Mhm.
think there's a huge component of that as well.
Yeah, definitely surrounding ourselves with the right people.
Hmm.
So, you know, obviously, love brain health. So, how does the brain body connection influence weight loss and wellness? And why is it so routinely overlooked?
Yeah. Well, the brain body connection is critical to our understanding in weight loss and overall health because it's the communication highway between our thoughts, our emotions, our physical body. It cannot be overlooked. And I mean, we know that our brain controls key processes like hunger and cravings and metabolism and even our stress response. And all of this directly impacts our weight and wellness. So, when we, for example, look at something like chronic stress, this can activate the brain's fight or flight response and releasing cortisol, which, if you don't know what cortisol is, it is this hormone that encourages fat storage, especially around the midsection. So at the same time, stress can drive emotional eating, leading us to crave high sugar, high fat foods that trigger the brain's reward system. And so this can really create a cycle where the brain reinforces unhealthy habits that make weight loss feel impossible. Another aspect in this is how the brain regulates hunger and satiety through hormones like ghrelin and leptin, which we talked about a little bit before. And so, for some people with genetic variations, this affects how these hormones function, making it harder for them to feel full or manage cravings. So, the brain will also process signals from the gut from what many and I call the second brain, which I'm sure you might call it that as well. So the gut then plays this huge role in mood, energy, and metabolism. And so an imbalanced gut can really send these distorted signals to the brain, further disrupting this brain body connection. So, unfortunately, traditional weight loss programs often ignore this connection and they focus on calories in, calories out, overlooking the role of mindset, stress, brain driven habits like we were just talking about, like meal prep, which is a really good brain driven habit in sustaining results. And so when we factor in the brain body connection, we can address the root cause of weight struggles like stress management, emotional eating, and hormonal imbalances to create this more holistic and effective path to wellness. So by prioritizing this connection and then aligning these strategies with your genetic blueprint is when we can really help the brain and the body work together for this sustainable, effortless health that I've been talking about. So, this is why we don't just focus on diet and exercise, but it's also about this rewiring of mindset, managing stress, and aligning health practices with how the brain and the body naturally function.
Yep. Yeah, that reminds me of many of my patients who are like, are you really saying my stress can impact me and make it so I can't lose weight or make it so I can't get better? I'm like, yeah, actually,
Yes,
it's
100%.
it is
Mhm.
that strong, when we look at
Mhm. Mhm.
so a lot of people are looking at it from gut to the brain. I look at it more from the brain to the gut, right?
Mm.
So when we have a lot of stress, we shut down a lot of the vagal output that goes to the gut, which helps to
Very true.
produce stomach acid, which you need stomach acid to activate digestive enzymes. And you need to
Mhm.
have proper motility and intestinal lining, all of that. And so
Mhm.
it's really on both sides, but it is bidirectional, right? Because the gut impacts the brain turns around, it impacts the gut, and you can get stuck
Yes.
in this vicious cycle that so many are in, you know. And we've talked about a lot of things from stress to cravings and everything else. And we've hit this one a little bit, but I want to jump in a little bit more. So, what are some of the common misconceptions about weight loss that you found with your genetic approach that you've been able to debunk?
So there's so many misconceptions about weight loss, but the biggest one, and I think we've touched on it, is this idea about willpower or just simply eating less or exercising more. I mean, calorie balance is important, right? You can't just go out and eat buckets of ice cream, but this oversimplified approach really ignores the powerful role in genetics in shaping how our body responds to food, activity, and stress. So, for example, a common belief is that a slow metabolism is the problem for people struggling with weight loss, but in reality, it's genetic factors like reduced thermogenesis. So, if you're looking at the UCP1 gene variants, effective fat storage, so you're looking at the FTO gene, and then carbohydrate metabolism issues, so how you're processing all of this carb rich food that we have in our society. So that would be the PPARG gene. So these can be driving these challenges as well. So, looking at factors in how our body burns energy and stores fat, making weight loss harder for some individuals despite their best efforts, is what we really should be doing instead of, you know, giving people a lot of shame and making people feel like they're not doing enough. Another myth is that cravings and overeating is just purely psychological. So we talk about that a little bit, and we did talk a little bit about how genes like the DRD2 gene can influence dopamine signaling, and so this will make people more prone to reward-driven eating. And then we mentioned about leptin and MC4R, which will disrupt hunger and fullness signals. So really, again, looking back at things like how stress can affect stress and inflammation, which are also influenced by genetic factors. And the fact that things like fasting can worsen stress markers, can worsen your cortisol regulation. And so it doesn't matter how perfect the diet or exercise plan is, it's more so about addressing this root cause of weight challenges and making it something that is sustainable and something that you can stick to.
Yeah, so I want to go into fasting really quick because it seems it used to be very big, like, hey, you know what, intermittent fasting or some prolonged fast, right? There was a lot of research in animals and stuff that was like, oh, look at the benefits. But
Hmm.
now it almost looks like the community's really kind of mixed, right? You've got those who
Yeah.
are still very much embracing the fasting, and then you've got those, like um Peter Attia on some of his stuff, he's like, well, it's there comes a point where maybe when you're 40 or above, it's really not worth it because of what it can do to not only stress, but also to muscle. So,
Mm-hmm.
you know, what are things, that maybe use to help to decide like, hey, is fasting good for one person than another? Because what I think we don't want is people just hopping on what they consider the fad. It's like, well, I know someone else who did it. It's like, well, yeah, but do you have the same stuff going on? Do you have the same genetic influences?
Yeah. hmm So the main things I look at is the clock gene, which will tell you if you should be eating in a certain timed window. And then another thing I look at is the NR3C1 cortisol regulation and inflammatory markers. So if someone has that, they're more predisposed to not do well with fasting and actually to have elevated levels of chronic stress and inflammation. Those are the things that I use to help guide if someone should be fasting. Um, if someone has a lot of insulin dysregulation, if they are over snacking, overeating, then of course eating in a closed window and really something that's as simple as eating when the sun is up. When the sun goes down, you stop eating. And for some people, they would look at that as fasting, but really that's a more mindful way to eat. So I think it comes down to looking at one, how you define fasting, and then two, making sure that you are looking at all of these genetic factors.
Okay. And then so let's talk about, right? So obviously both guys and girls both struggle with weight loss, but it tends to be that women are the one who, it seems, they're more looking for help. Maybe guys do it a little bit more in the shadows.
Yeah, can you
That's kind of
tell
what
me,
I've
is
seen.
that what's happening? You think? I think it's easier for you guys. You don't think so?
I think guys, it's often done in the shadows. Like I think
Interesting.
about my
Wow.
clinic over the years, right? Like I've always seen more females for almost anything, right? They're
Mm,
like, hey, look, here's the way I'm feeling. I don't think it's normal. Whereas guys almost have to get pretty broken
mm,
till they're trying to do it. And it's not because the guys aren't researching, right? Or talking to people at the gym or other things like that, but they're not often as outwardly trying to do it.
mm.
But it's kind of
Well,
my
that makes
thoughts.
well, that makes me sad. You guys should reach out for help always.
So so for people, who are struggling with these chronic health challenges, where should they start, when it comes, to using genetics? Because there's a lot of different genetic tests out there, and people may go to Google and try to do it. And we know not all genetic tests are created equal. And we want to make sure, that people are, if they're doing something, they've got the highest likelihood of achieving the results they want. And not only that, but that the results they are given actually have some meaning behind it, because just because a test can be ran doesn't mean it's got a true clinical application.
That is so true. And sometimes some people are grabbing these tests online and they're not understanding how to interpret it or trying to figure it out themselves. So, really, I think working with a professional that has done this before, whatever type of dust testing you're doing, whether it's genetics, just looking at gut health, if it's working with someone like you in terms of understanding how our brain affects all of our bodily functions, you should be working with someone who can help you understand all of these major areas of metabolism, hormones, and inflammation. But how you can implement some of this testing information is looking for patterns in your symptoms. So this provides, especially us as providers, with a wealth of information. If you're able to tell us how your body reacts with certain foods, certain scenarios, chronic fatigue, craving, stubborn weight, and brain fog, they might seem like isolated issues, but they're often interconnected through genetic pathways. And so mapping symptoms to genetic tendencies can help you identify what I call as your genetic avatar, such as being a cortisol carrier, inflammatory overload. And then this will help you direct your focus to your specific root cause. The next thing I would say, once you do get started and okay, you get all this information, take small targeted steps. Okay, so sometimes we get all this information especially with genetics, it will tell you everything. It'll tell you if you are prone to, risk of dementia. It's going to tell you what medications you can take. Rather than overhauling your entire lifestyle, focus on these small targeted changes. For example, if you're a dopamine driver, strategies to stabilize your dopamine levels could be a consistent protein intake, stress reductions, will curb your cravings. And then, like we were talking about, is focus on that brain body connection. So, chronic health challenges often stem from this brain body connection, and it can be influenced by genetics. So, if we address the stress response from the NR3C1 gene, improving gut health can really improve your physical and emotional wellness, making it easier to make these changes lifelong. And then again, back to like what I said, really seek expert guidance. Genetic information is going to feel super overwhelming at first, but when you're working with someone who specializes in personalized genetic based strategies, then you are going to make sure you're interpreting your results correctly and then aligning your solutions with your unique needs.
And something I want to go into, on the brain body side, and it's almost more of mind body, but it's, a lot of people, it seems they tend to fail because they're not ready to embrace a new identity.
Yes,
Um,
that's so good.
what did you kind of go through on that? Because
Mhm.
whenever you go, right, you're a physician, you lose 100 pounds. How was that identity shift for you? Where was there kind of resistance and stuff on that side?
Everywhere, every step along the way, when you're becoming this new person and anything, not just weight loss, but finances and love, and you're changing your identity. So it was embracing that. But first, I mean, obviously having my genetic report and things starting to work and okay, I lost the first 20 pounds. It was like, oh my goodness, I can do this. I can be a person that is fit, is healthy. And it comes down to the things like packing your lunch, right? If I'm seeing myself, and I was looking back at some of my photos in the middle of my journey when maybe I still had like 30, 40 pounds to lose, but I still saw myself as someone that was my current weight, someone that was healthy. That was my identity by the time that I was in the middle of my journey. I was someone that was completely healthy. I was eating as someone that was healthy. I was exercising as someone that I saw was completely healthy. I was waking up at 5 o'clock in the morning so that I did have time to do my walk and to pack my lunch. So when you make that next step to identify as what I call future you, then that's when things really start to shift in any aspect of your life. So if something feels stagnant, if something's not moving, if something is not shifting, really look at how you identify. I have had, clients come and say, "Oh no, I have a sweet tooth. I'm someone that always snacks. I'm someone that always stays up late at night," and really will hold on to that for dear life, even though it's detrimental to them or is keeping them away from their goals.
Yep. Yeah. No, that's some of the worst things people can say is when they say
Yeah.
I am, because, that's the
Mm,
identity thing.
yep.
You know,
Yep.
and going on this a little bit more, did you find there was any resistance, with like family, friends,
Mm,
or coworkers, because that's a big thing so many people run
yes.
into. I was watching Jillian Michaels. She had a lot of the people who'd won The Biggest Loser, and she was talking about people who succeeded and then people who were like, she's like, this person killed it, but they lost, they gained all the weight back because that was their relationship with their mom. Was this person was
Mm,
unhealthy and their mom was unhealthy, so they went right back so they wouldn't impact the relationship.
yes. I mean, people see you in a certain way, and I love, love, love my husband. He's such a huge support, but and he's super fit. But I remember just even recently, he was like, "Oh, you're not fun to eat with like you used to be, it just what?" And so when you relate certain things to be like, that's what he would do out of love is prepare these very elaborate meals, and so that can cause resistance when I don't necessarily see myself as someone that eats. past the point of being full. And that is a huge trigger for other people. They don't want you to go to that next level because that means that they have to address something in them. Now, if you are sitting side by side with them and participating in this self-destructive behavior, everything's good, everything's hunky dory, nothing has to change. But if you are the person that was doing it with them, and I'm not speaking about my husband, but I'm saying other people that might have friends or family that participate in this activity with them, and they themselves don't want to change, you are going to be a huge trigger for them. They're going to make so many comments. Please remember that those comments are more about them and nothing to do with you.
Yeah, and I want to go into that, just like you brought up about your husband, what advice do you have for the husband, for the wife, for the parents, right?
Mm, mhm.
Um, to support someone along the way, because it's really both are having identity shifts. Not only the person losing weight, but the person who's used to interacting with them, and they may be like, oh crap, like I'm used to us going out to this restaurant or me
Yeah.
doing this for you. Are there any tips on that side?
Very much so. When I used to do weight loss for families, I would only counsel the parents. At some point, I would even have the children step out of the room for a little bit of it because the weight loss counseling is for the parents. They are the ones preparing the meals for this child that is underage. They are the ones getting the groceries for them. And so this is information that the parent needs to know, not to shame the child, because sometimes the child is shamed. Why can't you eat better? But then also to know how to support them in these new changes. And then what I would say for spouses, God bless my husband. There's a video on my Instagram, my team posted today, and it's me crying on the floor in the very beginning of my journey. And he recorded it because I think he knew I was gonna do it. I was gonna really do it this time, and I didn't. He was like, "What's going on? Talk to me. Tell me how you feel." And he was just having me just, talk about how I felt and just be there for people like that. Be there, believe in them, let them really feel that you believe in them because that's everything. Believe in them when they can't believe in themselves, and that's gonna help change their mindset to helping them understand that they can do this. It makes
Yeah.
all the difference.
Now, so we've talked about your success. Can you share a success story from one of your clients, who's been in similar shoes? Because everyone's like, oh, well, it's easy for you to say because you're the provider, right?
Yeah.
But can it actually work for other people who've kind of went through the gamut?
Yeah, definitely. And again, I will talk about this book because this book has all 12 genetic avatars and then it has 12 stories of different clients that I worked with. But the client that sticks out most to me in my mind is a client who, before her wedding, was on a GLP-1 and had such severe complications from it. She lost 20 pounds, but then gained back 30, ended up going to the hospital, had gallbladder surgery and was really at her wit's end because her wedding, I mean, you're not going to cancel your wedding because you haven't lost weight, but I think at some point she felt tempted to. She was really at her wit's end. And it wasn't until we started working together that we realized that all of the things that she was doing was causing her to not budge any weight and to gain more weight. And funnily enough, it does come down to cortisol for her. She was a cortisol carrier. She was someone that was exercising morning and night, doing the wrong exercises, doing a lot of cardio, but also depleting um, a lot of her muscle mass because she was under eating and really trying to starve herself. And then she would go into these binges and then regain back a lot of fat mass as well. So being able to understand that portion for her, but then also letting her know that histamine was playing a huge role in her being so inflamed and so bloated. And so being able to cut back histamine containing foods, people don't know that alcohol is huge for histamine. That is something that was massive for her, so that we put her on a low histamine diet and an anti-inflammatory diet, and also changed her exercises. She just walked 20 minutes every single day, and she fit so beautifully in her wedding dress. But not only that, because I remember fitting beautifully in my wedding dress, but then gaining like 80 pounds, like almost immediately starting from the honeymoon because all of my bad habits came right back. And that wasn't the case for her. she wanted to also keep her weight down to be a healthy mom and get pregnant after she her wedding, and she did. And so she's still maintaining her weight even after having baby. And so that she is one of my greatest success stories because it's been years and she's still doing great.
That's awesome, because we do know obesity does impact fertility rates.
100%. Yeah.
And along, with fertility and all that, right? There's always the conversation on hormones. You know,
Hmm.
do hormones matter with weight loss? Are they overblamed? Are they not appreciated enough? For both the premenopausal, right? Someone who's just having regular menstrual cycles, as well
Hmm.
as someone who's in the perimenopausal, menopausal
Yeah.
phases of their life.
So, one thing that I think people fail to remember and like realize is when we're talking about hormones, and oftentimes on Instagram or social media, it's talking more like hormones like estrogen, progesterone. But when I talk about hormones, I talk about the fact that hormones are these chemical messengers for every function in our body. So, metabolism, hunger, energy levels, fat storage. And so, um, I'll go through some of the hormones that I've seen be out of whack for some of my clients, but hormones will drive chronic symptoms like fatigue, weight gain, cravings, inflammation, and then your genetics play a significant role in how these hormones function, making it crucial to address hormone for any weight loss, but any wellness program. So, for example, we did talk about the hunger and satiety hormones. So leptin, ghrelin, they regulate hunger and fullness. And then the genetic variants in leptin and ghrelin genes can impair these signals, leading to constant hunger or inability to feel full. And then there's the stress hormones that we've talked about, cortisol. There's insulin and blood sugar regulation. So, insulin is the hormone responsible for managing blood sugar levels, and it's very disrupted in women with genetic variants like TCFL. L2, and this can lead to insulin resistance. Insulin resistance is important to understand because then you start to deal with things like PCOS, weight gain, energy crashes. Then there's thyroid hormone, and thyroid governs metabolism and genetic variants. In The DIO2 hormone can affect thyroid hormone conversion, leading to lower energy levels and weight loss resistance. And then, of course, for women over 30, estrogen and hormone balances, hormonal shifts related to estrogen can really significantly impact weight and energy. So, specifically, genetic variations in estrogen metabolism genes like CYP1A1 or COMT will predispose women to hormone imbalances that affect fat storage and inflammation. So it almost feels like you just look at a cookie and then you're gaining weight. So what we do in that case is we support estrogen detoxification and balance. And this is so important for women transitioning into perimenopause or menopause.
Okay. All right. Last question I've got for you. And this is something I've been thinking about, is I've told people one of the big things I think that's really impacting food and weight. It's, when we look back ancestrally, we were always localized to certain areas and that's just where people were, whereas now it's very global, especially within the past 20, 30 years. No one lives where they grew up. You got people from other countries and now you're kind of mix matching genetics that it's like, well, this was from Europe and this was from South America or this was from Africa and this is from and you're just like, you know, do you
Where
see any like specific patterns on stuff like that where it's just like, you know what?
Yes. So I thought that I would see more variation in terms of this group of people eat this and that's why they're overweight. And funnily enough, the gene expression and the way that it presents in our body is something that can change, and that's epigenetics. That will change based upon how your family eats and how what kind of health strategies your family has. So what I've actually seen on my focus for weight loss is more disease genes playing a role in people that have a family history of not being healthy, eating more processed foods. That has played more of a role, more so than ethnic backgrounds. So I've thought that was pretty
Okay.
interesting in my work at looking at genetics.
Interesting.
Mhm.
Well, this has been great having you here. Now, where would people go to learn about you? I know you've got a new book coming out as
I
well.
do. I have my book, Lean Genes. Head to geneticweightloss.com. You will get all your information about all things genetic weight loss. go grab my book, Lean Genes. It'll answer everything you want to know about genetic weight loss, about these 12 different avatars I've been talking about. We also have a genetic avatar quiz. So you go to geneticavatar.com. So you can what is Dr. Phyllis talking about with these avatars? Well, head to geneticavatar.com or just go to geneticweightloss.com. That'll have everything there to answer your questions, and we can set up a time to chat and talk all things genetic weight loss.
All right. Thank you so much. It's been great having you here.
Oh, thank you so much for having me. What a great chat.
If you have found the material valuable, please subscribe to my YouTube channel, Dr. Spencer Zimmerman, and leave us a 5-star review on Apple Podcasts or where you normally listen to podcasts from. If you would like to work with me, visit peakbrainandbody.com to learn more. You can find me on YouTube, Instagram, Facebook, or TikTok, all with the handle Dr. Spencer Zimmerman. I'm also on X with the handle Dr. S. Zimmerman5. This podcast is for general information purposes only and does not constitute the practice of medicine, nursing, or other healthcare professional services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials are to be used at the user's own risk. The content on this podcast is not meant to be a substitution for medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they have and should seek the assistance of their healthcare professionals for any such conditions.